Hi everyone, and welcome to Full of Life, how technology can help with independent living. Delivered today by Richmond Adult Social Care in partnership with Alcove. Today you can expect a short presentation. Please do pop any comments or questions in the chat box, and we will do our very best to answer them for you towards the end of this half-an-hour session. So let's start with some introductions. My name is Charlotte Blaney, and I'm the Assistant Service Manager for the Front Door Hub. And we are a project team working closely with our existing access team at the first point of contact with adult social care. My email address is there and my contact number. If you have any questions outside of this session, please do feel free to get in touch. I'll now hand over to my colleague.
Hi, my name is Wendy Jones, and my title is Digital Project Manager, and I work with all the adult social care teams looking at different aspects of digital technology. And I'll be talking today about how we are rolling out care technology across the borough.
Excellent, and hopefully you can all hear me okay. My name's Kerry Robinson. I'm the Senior Operations Manager at Alcove, and Alcove are the company that are working with Richmond and Wandsworth Council to roll out one of our products called a video care phone.
So I'm just going to start today by talking about care technology and what we've done in the borough so far, as well as looking ahead to what we are planning to do in the future. For us, care technology is really important, and it became even more important during the pandemic because, as many of you know, lots of face-to-face activities stopped. Some activities moved online, but people became incredibly isolated because they no longer were able to see people who were coming in and out of their homes. They were no longer able to participate in social events. What we have now is we either have face to face events that have started again with some limited attendance because of social distancing, which is one of the reasons Charlotte and I are sitting in the same room, but you see different backgrounds because we're also distancing from each other. And one of the other things that has happened is some activities are now what's known as a hybrid format. In other words, there is some online and some face to face. But what we don't want is for people to be excluded. We want to provide an opportunity for everybody to be involved in activities and to be connecting with other people. So care technology, which is any technology which enables us to deliver care, and that could be care of any sort or description in either somebody's home or in the community. Care technology is one way that we can use to help people to stay connected with one another and to help reduce social isolation. Kerry's going to talk a little bit more just now about one way that we actually rolled this out in the pandemic, and we continue to offer the product that Kerry's company has produced as a service to our residents. What we found when we rolled out the care phone and with the work that Charlotte's team have done is that people actually have embraced technology. So they might be anxious about it, and we do our level best to help people to master it. Kerry's product is actually a really easy product to use. And I can attest to that because I tried it out for myself, having been told how easy it was. I wanted to check that it really was as easy as I was told. But what it has helped people to stay in touch with one another, families to stay connected with their loved ones, friends to remain part of their friendship circles, and in some instances, people who are part of social clubs who have now moved those activities online to remain part of those activities and more. What we want to do is to use our technology to help people to live independently at home for as long as possible, preferably to the end of their lives. We would like people to be able to have good mental and physical well-being, And so whatever technology we can think of that will assist in that process is something that we are eager to ensure people have access to. One of the ways one of the projects that I will be involved in over the next 12 to 18 months is the rollout of a new telecare service. Now, you may be familiar with the telecare service, or you may actually have one of those devices in your own home. You may or may not be aware that all phone lines in England are going to move from an analog system to a digital system. And what that means new technology that is going to enable people to continue to have their devices. For now, you do nothing because things carry on, and we will be in touch with you as and when changes need to be made. But your devices will carry on working, and you need to carry on using them in exactly the same way as you always have done in order to ensure that you have the service that you need. So just to share with you some of the work we've done around digital technology so far. So we have spoken to our residents who are service users, and some of whom are not service users but interested in the use of technology. We have spoken to our staff, and we've spoken to the providers who provide a service to our residents within the borough. We've done quite a lot of talking with our staff because we want them to include the care technology offer as part of the service that they offer. And it's been really good to see staff getting involved, thinking about being creative about how we can use technology to help people. We have started the pilot projects, the one being the Alcove Care Phone, which Kerry's going to talk about. Brain in Hand, which is a very clever app which is available to some of our residents. The Internet of Things, which is a project we're busy rolling out at the moment, where we're using sensors to monitor temperature and humidity in people's homes. We're not monitoring their movements, and we're not looking at what they're getting out to. But that information is telling us that people are up and about, that people are able to make a cup of tea or get a meal for themselves. And it's also telling us where somebody is in crisis, that we need to get help to them quickly. So that's the Internet of Things project. And we have a great partnership with Rules on their assistive technology project. We've established the framework that we need so that the local authority can offer the services that we offer, and will continue to offer services and grow our offer. And the digital project team, of which I'm a part, has obviously been established. And we've started to work with our NHS colleagues too, because what we don't want to do is duplicate what we do. We'd like to have a joined up approach. So we see you as the person in the middle, and all of us who sit around you work together to get the best possible outcome for you. I've just put up a picture, which is the kind of devices that we're talking about and more. But this is what our new digital world looks like. So in that picture, you'll see things like Amazon Alexas, there are robots, there is something known as a cobot, which is a mechanical device which can be used in the delivery of smartwatches, smart buttons, and all other kinds of smart technology. But that's a flavor of the kinds of things that we are encouraging staff to deliver to residents. Some of which, as I say, have already started to roll out, and Charlotte will talk a little bit more about that. So why care technology? What is so important to us about ensuring that people have access to care technology? We believe that it can help become a preventative measure. So we'll be able to access care technology in order to delay or avoid other needs developing. So if we can put technology in place instead of other things, then that's what we want to do. We are also able, and staff are now able to assess for and provide care technology as part of an ongoing service from us in the borough. And staff are able to be as creative as they are able to be, and able to purchase and supply, and we will ensure that it arrives at your doorstep. We are also working with our staff to enable them to become more confident as confidence grows. So people will become probably a little bit more daring in what they do, which is what we want to see happen. And lastly, we are going to be recommissioning telecare. But just to repeat what I've already said, please do not stress and do not worry. Your service continues and you are not required to do anything. That will be for us to do and to make contact with you at the point that we recommission the service. I'm now going to hand you over to one of my colleagues.
Thank you, Wendy. So the Front Door Project Team and Care Technology. So the Front Door Project Team is a pilot that we've been running in adult social care for the last 12 months or so. And we've been focusing on having good conversations with local people approaching adult social care to promote and tech solutions at the first point of contact with us. So in doing this, we've been able to focus on and explore access to tech, how people can use tech with confidence and develop skills in technology or a piece of care tech. And then really importantly, access broadband or Wi-Fi packages to address digital inequalities and make sure that people get connected and can stay connected. So as Wendy mentioned, we've also been building up our confidence as a workforce. So as a team, we've done some research, some testing, and trying out some different pieces of tech ourselves and thinking about how they could best support or help. So in doing so, we've had a good go with Amazon Alexa, which is an assistive technology personal assistant that's voice activated. The Alcove video care phone, which you will hear much more about from our colleague Kerry, and then many other things, one of which being smartwatches to help monitor activity, fitness, or manage longer term health conditions. So we've been able to explore how these can promote well-being and independence, supporting people to stay active and well, and really important in contact with loved ones or people involved in their care and support. So hopefully these examples give an idea in terms of the practical day-to-day application. So these are a few good news stories that we would like to share with you. So the Alcove video care phone supported a resident who was shielding to meet their grandchild virtually, born during lockdown, when people weren't able to spend time face to face. And then, as mentioned earlier, we work in partnership with Rules, who deliver an assistive technology project. So we referred into the project, which helped a resident to access and set up a laptop and broadband at home. And this then enabled them to access online training courses and physio class. And then we linked somebody in with a robot Hoover, which was new to us all. And in doing so, this resident living with physical disabilities was able to take control of keeping their home clean. So the robot sorts out the kitchen, living room, bedroom, and bathroom, and then it parks itself back in its charging port. And then finally, we have the Amazon Alexa. So the voice control personal assistant has supported a resident with short-term memory problems, so some forgetfulness, to remember to take their regular medications, regular health appointments, and pick up calls from their family who would drop in virtually using the Alexa app. So I'll now hand over to Kerry, our colleague from Alcove.
Lovely. Thank you, Charlotte. So I'm just going to walk you through the video care phone, what it is, what it can do, and how we've been supporting Richmond and Wandsworth Council over the last few months. So Richmond and Wandsworth Council bought 200 of these devices, I think last year, and we've already provided 155 residents with one of these devices, and so it's been incredibly successful, and we've had some great feedback so far. So telling you a bit more about what they are. So as you can see on the screen, it is just a simple tablet. It's actually a Samsung tablet, so a mainstream tablet, but we lock it down, upload our software onto it and lock it down. So you can't actually swipe off of our software and use this device for anything else. It's been designed to be really basic and easy to use, so you have no tech skills needed to use this device. And how it works is it will display your contacts' names within a tile on the screen. So it's used predominantly for video calling, and that can be video calling anybody. So friends, family, carers, support networks, charities, health professionals, social care professionals, anybody that can would be able to sign up to our system and log in and do that video calling. We can set them up to be a caller on your device. Or similarly, you can connect this device to another care phone. So both people using them don't have to have an email address, a password. They don't have to swipe or anything to make their calls. We can connect them to each other, or we connect you via our app or our online portal. So to make a call for the user, it's so simple. They just get their tablet. They don't need to sign up to anything. They just press the name or the picture of the person on their screen to make that call to them. The callers are all added onto the device by us at Alcove. So we just need a name, a number, and an email address of the person they want to be able to call. And if you want to use an image as well, send us the image and we'll upload that onto the screen too. And then if you are contacted by this device, you will need to be logged into our app, which is called Alcove Connect. That's free to download on any Apple or Android device. Or there is an online portal for you to log into. So the portal can be accessed on your computer or your laptop. We can give you the web address and you sign into the app or the online portal using the same details. So your email address as your username and a password that you've created from us. And as long as you're logged into that, your video call will go through to you and you can have your video call via that platform. However, we don't want you to miss any calls from the people that are contacting you. So to avoid that, if you're not logged in to the app or the online portal, the call will go through to you just as a normal voice call, like a normal phone call instead, just so you don't miss that call because it might be important. There's some, as well as video calling, there's some other features here that you can utilize with these devices. So you can send it a text message if you're an approved caller. You can't reply to text messages because the way it's been designed, it's been designed to be really basic and easy to use. So if you add a keyboard to it and a reply to a text message feature, it overcomplicates it. And if people can reply to text messages, 9 times out of 10, they've already got their own mobile phones that they can do that on anyway. So you can send it a text message. So this could be, you know, I'm running late, I'm stuck in traffic, I'll be with you in 10 minutes. It just pops up on the screen in a box so the user can read it, they press OK and it drops the box down. So it's nice and easy. There is also a reminder feature that can be utilised. So Alcove can set up pre-programmed reminders that appear on the screen, again in a box, so similar to the text message, and they can appear as a one-off. We can set up just a one-off message that never repeats. Or you can have ones that repeat weekly or daily as well. So you can use them for medication reminders, or don't forget the bins go out today, or, you know, anything like that really. And with the reminders, you can set up to 5 different pre-programmed replies. So the person can receive the message and then they can select up to 5 different options to respond back. And you could be set up as what we call a responder. So you could be a family member, a friend, a carer. So the medication reminder goes up. The client says, yes, I've taken them. That responder then gets notified what that response was. So they can see, right, excellent, she's taken her meds, everything's fine. If she said, I've run out of meds, then that responder could then act accordingly and go and get a repeat prescription or go and support as needed. And those reminders and the responses are written in a free text box. So they can be written in whatever style or language of your choosing. And what we can also do is trigger an alert to let that responder know if the message hasn't been acknowledged at all. So if it is something important like a medication reminder and the client doesn't press a response, they don't acknowledge it at all, we can trigger an alert after an agreed time frame. That might be 5 minutes, it might be an hour, just to let them know that there wasn't an answer pressed, and then they can respond as needed from that point onwards. We also have a group calling feature. So this was built in the height of the pandemic, in lockdown, when a lot of day centres predominantly were unable to continue offering their service because they couldn't obviously get together. So what we've done is we created a group calling feature that allowed a host, so one of the day centre staff members, to log into our Alcove portal or app. They can then create a session. They can name it whatever they wish. They can then arrange it for a set date and a set time and a set duration of how long it will last. And then they can invite multiple Carephone users into that session. And then to try and keep it as simple as possible, what happens 10 minutes before that session was due to start, the host would get a join button on their invitation, and the Carephones would receive a new caller tile appear on their screen. So then what they do is they just press the tile as if they're going to make a normal phone call, and it allows them to join this group call with multiple people on it. And they started using it for activities, cooking, music, that sort of thing. But it can be really useful for lots of other things as well. So that feature is available. And then this device, it's linked in, like you say, to the Alcove portal or the app. Now, that's the platform you use to make and receive your calls, but it does also store and collect a range of data with regards to these devices. So as well as being able to see your friends, family, your people that you need to support, you can also see information about the device remotely as well. So you don't need to be there with them to see whether it's on and whether it's charging. So you can see if the status of it is good, it means it's on and it's working. If the battery level, you can see a live battery level of how it is at the moment. If it runs below sort of 30%, that's when we can trigger an alert to let an allocated person know that the battery's running low. We can also let you know if it's been switched off as well, so then you can respond as needed. But it also stores all of the calls that have been made to and from the device, how long the calls lasted and when the calls occurred. So it's really useful for capturing some information there, as you know, are they receiving their care calls today, or has the daughter rung today as promised? And you can start to see all of that and build that sort of bigger picture of the support needs that are being met virtually through these devices. So I hope you found that useful. I will hand back over to Wendy and Charlotte. Or is that
Thank
the
you
end
so
of
much.
the question? Thank you, Charlotte.
Thanks, Kerry. Thank you. So yeah, that takes us to the end. So thank you so much for your time, and thank you so much for joining us. We've got a couple of minutes left. If there's any questions, please let us know.
No questions so far.
Okay, well, no problem. If anybody would like any further information or have a question that springs to mind after the presentation, please do contact us using the contact details provided in the presentation. But for now, thank you very much for listening, and we will say goodbye.
Thank you,
Thank you.
guys.
Goodbye.